Welcome, everyone. I'm Terry Alpert. I am a longtime supporter of both the Academy for Jewish Religion and Americans for Ben-Gurion University. It is my great pleasure to welcome you to what is our third annual Religion and Science discussion. Some of you may be familiar with one organization or the other, but I bet very few of you are familiar with both. So allow me to say just a few words about each remarkable institution. First, Ben-Gurion University. As you might imagine, it's named for David Ben-Gurion, the George Washington, the founding father of Israel. Ben-Gurion, after government, spent his retirement in the Negev desert, and he recognized that the desert is 60% of Israel's total landmass, yet it was barely inhabited. And he said, we have to make this desert bloom. The future of Israel will come from the south. Israel, David Ben-Gurion recognized, had to master this hostile environment, and it had to find a way to anchor the economic development of the region. And for that reason, the university was founded in 1969. Since it first opened its doors, much has changed, but David Ben-Gurion's original vision has never been stronger. BGU is Israel's fastest growing research university. It is the only one that provides its students with what we Americans think of as a residential college experience. For students and researchers looking for a really strong sense of community, it has become the institution of choice. And in this post-October 7th world of ours, it has a critical role to play in the future of Israel. BGU is leading the way forward, rebuilding the Negev community, building it back better and stronger than ever before. We at Americans for BGU rally around the university's remarkable work and its much needed apolitical beacon of light. Now let's learn a little bit about the Academy for Jewish Religion.
What I love about working with AJR students is that they come to spiritual leadership and Jewish spiritual leadership from lived experience and from a wide variety of lived experiences. And they bring all of their unique perspectives and experiences to Judaism and Jewishness, and AJR brings them together into constellations that I don't see anywhere else in the Jewish world, and also gives them a place where they can develop both the unique qualities of their relation to tradition and spiritual leadership and a strong sense of what binds us all together. They're what the Jewish world needs as we go forward in the 20th century.
Founded about a decade earlier than Ben-Gurion University, the Academy for Jewish Religion is a pluralistic seminary that has been ordaining rabbis and cantors since 1956. More than 2 decades ago, it's where my own husband began his rabbinic training after a successful career in business. When I tell people that my husband is a rabbi, their first question is always, what kind? Reform, conservative, Orthodox, Reconstructionist, renewal? The answer I give is always none of the above and all of the above. When we say that the Academy for Jewish Religion is pluralistic, we are saying that it trains clergy to serve Klal Yisrael, the whole of the Jewish community. AJR is especially welcoming to students who have considerably more life experience than those at the other seminaries, people who have already had one or more successful careers as lawyers, as scientists, as journalists, and even business people like my husband, you name it. AJR stands apart with its commitment to science and its commitment to understanding and supporting the state of Israel. So with that, let's turn to religion and science. In our inaugural seminar 2 years ago, we were privileged to listen to a rabbi and a scientist having a philosophical conversation. Then last year, we learned how cutting-edge scientific methods are being used to understand the conversations between the early Christians and the early rabbis of nearly 2,000 years ago. This year, we're going to take a different approach, and we are going to learn about a particularly relevant topic, vaccines, something people are really concerned about and talking about today. And we're going to hear about the Jewish thought on vaccines and public health as it has evolved through the ages. And so let me now introduce our two amazing panelists from whom we are going to learn so much. Rabbi Jill Haskell is an MD. Before she went to AJR, to rabbinical school and became trained as a rabbi, she was a Johns Hopkins trained medical doctor with a specialty in pediatrics. She then left practicing medicine to spend more than 20 years in the pharmaceutical industry, directing clinical research on new vaccines. After receiving her ordination from AJR, she became the rabbi of West Clarkston Jewish Center in New City, New York. And today, she's also a graduate level instructor on bioethics at both AJR and at the Dominican University, where she is also a trustee. Professor Nadav Davidovitch is a doctor, a PhD, and a master's of public health at BGU. He brings his multidisciplinary training as both an epidemiologist and a public health physician, and his own deep interest in bioethics to shape both his research and his advisory work. At BGU, he's a full professor in the School of Public Health. He chairs the health policy program, and he has served as an advisor to the Israeli government on its coronavirus policy. During Operation Protective Edge, Professor Davidovitch was the commander of an IDF medical reserve unit of more than 700 other medical personnel. And he's not just a scientist, he is somebody who is also deeply, deeply schooled in traditional Jewish learning. So I think you'll agree we couldn't have found two more qualified people to help us understand the topic of vaccines from both the scientific perspective and from the religious perspective. And I think most of you who have tuned in are not going to be surprised that those perspectives have never been at odds with each other in Judaism. Throughout today's program, questions are going to come to your mind, and just go ahead and put them into the Q&A section at the bottom of your screen when you have them. And at the end of our program, we'll have 10 or 15 minutes for our speakers to answer as many of those as we possibly can. And with that, we'll jump in. And Jill, why don't you tell us a little bit about yourself and then start off this conversation with Nadav.
Thanks, Terry. It's a Jewish belief that we're all partners with God in making this world a better place. Also, pekuach nefesh, the saving of a life, is the most important mitzvah. And for me, our ability to prevent deadly infectious diseases is one of the miracles of medicine and public health. It's easy to forget about diseases we no longer see because vaccines have prevented them. From my days as a pediatrician, I vividly remember sitting with a mom whose young son had died of HIV disease, an awful bacterial disease that killed 20,000 young children a year in the US before the vaccine was introduced as part of the routine immunization schedule. Our trust in the public health system is so important. People need to know that vaccines are safe, that they work, and that without them, we'd be faced with many deadly contagious diseases. I can share firsthand knowledge of how the system works. When I was in clinical research, I met with experts in academia and with the FDA so that we could design the best trials to test the safety of new vaccines and how well they worked. My work took me to Germany, where loss of public confidence in vaccines had resulted in the resurgence of whooping cough. There were so many cases and so many unvaccinated children whose families now understood the importance of vaccines that we were able to show in randomized trials that a new vaccine worked to prevent the disease. Monitoring of vaccine safety is always critical, and with input from the FDA, I continued to design studies of new vaccines after they were licensed and in routine use. And I saw just how carefully the FDA and CDC also studied vaccines after licensure, with large safety databases set up to detect any warning signals that might arise. Now, as a rabbi and a teacher of bioethics, my role is different. Several years ago, there was a measles outbreak among an under and unvaccinated Orthodox population in my county in New York. And I helped people to understand that there was not a Jewish religious reason that this population was unvaccinated. On the contrary, Jewish values strongly support immunization. And I'm sure we'll get into these in more detail as we talk today. But first, I'll turn things over to you, Nadav.
Thanks a lot, Jill. We had a wonderful conversation preparing for this webinar. So as mentioned, I'm a public health physician. And originally, actually, I planned to become a pediatrician. But because I did first my medical school and only later joined the military and served as a military physician, I found myself after doing my field duties within the Army Health Branch and later the head of the epidemiology department. And the issue of vaccines became probably the most thing that I was engaged, including, by the way, the question of vaccine hesitancy already. I need to say that everyone that got into our department, I think 99%, finally I had a conversation and we succeeded to have them being vaccinated. I think vaccines in many ways are presenting probably the best of public health because in contrast to other medical interventions, this is an intervention that is based on the community. Everybody probably knows the term herd immunity. I don't like the term herd immunity because we're not animals. We discuss it also during COVID, and we prefer the term community immunity, but it's clear that probably in most vaccine, I won't enter into many details, but measles, polio, etc. When you're being vaccinated, of course, you are healthy. It's about prevention. So sometimes it can be a bit hard to think about that. Although I'm healthy now, I'm introducing something into my body. But a part of protecting myself, I'm also protecting my family, the community. So unlike traditional clinical bioethics, in public health ethics, we are not ashamed to speak about solidarity, to speak about the community. I published a paper many years ago about Theodor Herzl utopian book called Alt Neuland, the Old New Land. And those of you who are familiar with the book, Herzl had already in 1902 a very clear vision about mother and child healthcare stations, vaccinations, and it was part of his social vision. It was about solidarity and, of course, preventing diseases at that time, rabies, cholera, etc. Unfortunately, in recent years especially, although we must say that in the history of medicine, resistance to vaccination started from the beginning because of this idea that you are healthy and you're introducing something foreign to your body. But in the last decade or so, and unfortunately also during COVID, We saw more and more skepticism. We see disrespect to science and scientists. Unfortunately, we know the tension, for example, with key people like Professor Anthony Fauci, became a hero for some and maybe a villain for others. For me, he's a hero, of course. And having this decision should be based finally of being vaccinated, as you said, Jill, is about trust. This is why we must remember that vaccination is not enough. We need to deal with social determinants of health, and we need to do it not just in an emergencies like COVID or when there's an outbreak of measles, but we need to interact with the community to show the community that we care about them, we care about their standard of living, about all the social determinants of health, and adding, of course, vaccination is something important. And maybe I'll just finish this part by saying that, again, for me, vaccination is almost part of my identity. During COVID, as was mentioned, I was part of the advisory committee, and there were lots of issues, including the booster and vaccinating children. And I think in retrospect, we could do better in terms of being transparent to the public. This is crucial. And also, we worked a lot with religious leaders. I think this is so important. In Israel, we have the ultra-Orthodox community. I know also in New York, sometimes it can be a problem. The ultra-Orthodox community is not monolithic, and we found many that could work with us and promoting vaccination. And then we approach them also with Jewish values, such as solidarity, such as, for example, Maimonides that discussed a lot the importance of prevention. So I totally agree with you that in many ways, vaccinations and public health more broadly is deeply embedded into the Jewish tradition. By the way, also other religions. And this is why we must have a continuous dialogue in regular times. This is why I'm so happy we have a discussion today, because that's something we must talk, especially currently with all the dangers of anti-science, of fake news, social media. And again, we need to do it all the time, and creating trust by not just discussing vaccination, but also things that communities are maybe looking for, and having this kind of an open dialogue, because otherwise this can be very dangerous. People forgot what happened in the past, as you said, and we remember with polio, measles. Sometimes the danger of prevention is that when it's successful, we forget what was without these tools. So this is something we need to continue.
Yeah.
So, Jill, I'll be very happy to hear from you how you think about the current situation when things became so polarized and vaccination can become a political issue that I think it's very sad in a way, how we can deal with it.
Yeah, I think vaccines has become very much a political issue. And I think part of the problem is that, at least here in the United States, we didn't communicate very transparently. Our public health institutions didn't communicate so transparently. They were learning by the day, and yet felt like they needed to make believe they knew what they were saying, was correct. And then when more data came in, and in fact it wasn't correct, it looked like they were flipping. I think that we need to teach people how, we need to be transparent how vaccines are approved, how they're studied. The COVID vaccines here came out very quickly, and people were suspicious about that. But in fact, the companies, more than 5 times the number of people they had working on those vaccines, they were able to process data so much more quickly than they usually did, that they were able to get information earlier than they could. And don't forget, when we do vaccine trials, we have to wait in the normal circumstance, like the trial I did in Germany, we had to wait for cases of disease. With COVID, we didn't have to wait for cases of disease. There were way too many cases of disease going on. So those trials were able to be done very quickly. But the other problem is that our communities are breaking down. I heard an interview by Robert Putnam, who's the guy who wrote Bowling Alone, who has been talking about the breakdown of community in the United States and how he thinks the fix for where we are now is a reestablishment of community. And Judaism can be an example for that, right? We Jews look after each other, but we look after the greater society as well. We look after the weak in the society. And this communal idea, like you spoke about, can really help people feel like they're all in it together. And maybe then the vaccination, not only for myself, but to protect those others in society who can't be immunized, either because they're too young to be able to respond to the vaccine, or if there's going to be a certain number of people, like a vaccine that's 95% efficacious. It still has 5 out of every 100 people who maybe don't benefit from the vaccine, and those people need to be protected. With COVID, we see that the elderly and the immunosuppressed are at risk. Immunosuppressed people here are very, very worried because now the people around them aren't getting vaccinated, and the vaccine may not be effective in them, even if they do get vaccinated. So being in it all together is something that our Jewish values can really teach us. And if you'll permit me to just go on the side for a bit, Rambam, Maimonides, based on Talmud, says that anybody who's able to save a life but fails to do so violates, "You shall not stand idly by the blood of your neighbor." And the Talmud also turns that around and makes it a positive commandment. Just as one is obligated to restore the lost property of one's neighbor, so one is obligated to restore him back to health. So I think our whole Jewish training is all about community and helping not only ourselves and thinking not only about ourselves, but helping the people around us as well.
Right, and there's a famous quote that Kol Israel Arevin Ze Laze, meaning that we all responsible for one another. And of course, I take the interpretation of not just Jewish people, but going much broadly. And also Maimonides was speaking about our responsibility for every human being. I think if we take again COVID or other vaccines, there is a misconception that low vaccination rate is mainly because of resistance to vaccination. And I can say that from my study in Israel and doing comparative studies with other societies, most of the time, of course, there's the issue of vaccine resistance and vaccine hesitancy, and different reasons why people are hesitant, and trust is one thing, and misconceptions, and we need to tackle this. But according to the studies we did, the most efficient way to raise vaccine rates is to have much better access. When you have much better access, and I'm talking about physical access, but also cultural access. Of course, there's the issue of economic access. So in many countries, also in the US and also in Israel, many times we want to have vaccine free of charge. So they'll be available because even from the cost effectiveness, it's much better to invest. And we know that if communities, for example, have the option to be vaccinated in certain place. It can be a synagogue, it can be other religious places, and they know that every week there'll be the vaccine team doing a mobile clinic. We know that this is working. We had it in the Bedouin community in Israel, for example, a mobile clinic that went into a mosque. We also had in Israel bringing different incentives, and again, it's a bit funny, but going to Bnei Brak, to a Hasidic place, and having chulent also with the vaccines, or having knafe maybe in another place, and turning the whole vaccination thing as a happening, and having the community also discussing other preventing things. And again, it must be not just about vaccination, but about public health. This is why mother and child healthcare centers, for example, that in Israel are so successful, Tipat Chalav, drop of milk station, because they're not just doing vaccination, they're doing health promotion, breastfeeding, they're doing community services, working also with the elderly. And this kind of approach, as you said, it's integrated into Jewish thinking and also other religion. It's quite easy to discuss with religious leaders. And we know that we have what is called neighborhood as a social determinants of health. So if we're investing in neighborhoods and communities, again, vaccination would be just one aspect, but also proper housing, proper access to education, fighting these really dangerous trends of fake news. So then vaccination would be part of something broader. Maimonides called it Shvil HaZahav, the golden path, or I don't know how it's being translated, meaning that prevention should be something that is related also to the way you are eating and the way you are doing physical activity, and also being vaccinated. And this way, I think it's a much more integrated approach, even planning the community that walkability would be nice. I'm saying that because sometime again, we are approaching certain communities only in an emergency without having the trust. And when you're coming there and saying you must be vaccinated, they can tell us, okay, now you're interested in our community because we are afraid that you'll be infected. But what happened before? So when you have this continuity of care and the broader vision of prevention, that vaccination is part of it. Vaccination, by the way, is called a vertical intervention because it's something that is medically important versus horizontal interventions that are more about social determinants of health. Some also coined the term diagonal, meaning using both vertical and horizontal. And for me, it really resonates. Maimonides, Judaism, the question of responsibility, working with community leaders and understanding that there is a lot of situated knowledge and local knowledge by the community, bringing to us what they feel is important for them. And when we're addressing that, then they'll be much more open about vaccination. I wonder if this community thing, I guess it's also a very strong component in your life, I guess, maybe also now during the Gaza war and what's happening now with the Jewish communities. I don't know if you see it related at all.
So you've taken me back to a memory of when I used to work in the well baby clinics in Rockland County. Our county, I think these were county level clinics that were set up so that there would be easily, as you spoke about, easily accessed clinics available to all the people who might not have private pediatricians, who might not want to pay the administration fee that goes along with immunizations that are given in private offices. And we really served a very diverse group of people. They came in speaking Yiddish and Creole and Spanish it was open to all, and all could get vaccines for free given by the government. You know, and it's so important to continue the funding, both local and for us nationally, for those kind of clinics, because I absolutely agree to you. And this prevention, I also had a memory of actually visiting Ben-Gurion University and visiting one of the Bedouin immunization clinics in the area, and seeing how people came to talk to the mothers about the vaccines and about the health and the importance of coming back for vaccinations. So it can be done. It requires, you know, dedication and funding, and a realization of how important these things are. And it is prevention. And since it's prevention, I'll go back again to Torah and talk about how important prevention is in Torah, where it says, when you build a new house, you are responsible to make a parapet for your roof, so you don't bring blood upon your house if anyone should fall from it. You know, vaccines are wonderful preventative medicines, and we really have an obligation to prevent diseases that, thank God, we can prevent.
I totally agree, of course. I want to bring another dimension, how to be attentive for communities. For example, sometimes there is some hesitancy about the HPV vaccine, the human papilloma virus. Some are saying HPV is immediately connected to sexual conduct, etc. So I want to say that in some discussion we had in Israel, of course, HPV vaccine is finally to prevent cervical cancer. And this is the message that should be there. And this can be also important when you have a married a couple. It's both for women and men. So if you remember, Jill, HBV, hepatitis B at the beginning was also very much connected to sexual transmission. And when they moved the vaccine very early after birth, so it's a kind of a desexualizing, because the vaccine for hepatitis B is also to prevent cirrhosis and the liver cancer, etc. So the HPV thing, at least in Israel, was part of our dialogue with different religious leaders, and maybe it would be a better idea, and we're considering it, to have HPV vaccine much earlier and not during high school. So kind of disconnecting with a kind of a myth, and of course this is not true, that, okay, we are going to vaccinate young adults, children, and immediately they're going to have sex or something like that. Of course, this is not the case. Of course, also there are so many other things that are relevant, like using condoms, etc. But the HPV is about reducing and trying to eliminate, because there are more strains of HPV, cervical cancer. So this is maybe another example of how to have a dialogue with the religious community and framing in a different way that is more acceptable to them. I see that Terry is showing us that probably we are getting to the Q&A, and I see also that there are some questions here.
Yeah, we have quite a number of questions for
Yes.
the two of you, and I think they're interrelated. Nadav, you have religion plays a role in your life, and studying religious texts has played a role in your life, and that has influenced how you have gone about your medical career and your public health career. But in Israel, is there any exposure to Jewish perspectives, religiously Jewish perspectives, as part of medical training in Israeli medical schools?
So I would say that there is, but it's like the half empty, half full glass. We are lucky at Ben-Gurion University, the Faculty of Health Sciences, and also School of Medicine. We have Professor Jotkovitz. He's both well-known a physician, but also an expert in Jewish bioethics. He's coordinating the bioethical studies, and I'm teaching there. And I must say that within the course and the simulation and etc., yes, the Jewish perspective is there, not just about vaccination, of course. By the way, and Jill, we discussed it a little bit, and we didn't mention it today. I want also to say that clinical bioethics and public health ethics are complementary, and like there is sometimes a bit of a tension, not in the case of vaccination, but in other aspects, between clinical treatment and prevention, hospital-based mainly versus community-based. Of course, pediatrician and family physician are also in the community. So public health ethics, the communities and solidarity is a very basic point there, while in clinical bioethics, it's much more about individuals, maybe also the families. So Professor Jotkovitz, and also when I'm teaching, yes, we are bringing also the Jewish perspective. By the way, I think it's important because we have a very large Muslim community in the Negev and in Israel in general, also to bring other aspects. We used to have in Israel several places where we had discussions between Judaism, Christianity, Islam about medical ethics. And of course, many times we have similar things, sometimes there are tensions. But I think with vaccination, this is something that we have lots of agreement. So there is exposure. Is it perfect? No. But we are lucky, at least at Ben-Gurion University, that we have Professor Jotkovitz. We also have Professor Shimon Glick, one of the founders of our faculty, about 90 years old, and he's still so energetic, and we invite him, both, by the way, originally from the US, coming to Israel. And I think this is a very strong basis that we can improve.
So let me ask Shimmy Cohen's question, which is, what is being done to train scientists to speak the language of the communities? And Jill, perhaps you could talk about what you know is being done in the US. And Nadav, you've already shared a little bit of that, but perhaps you can give us a little bit more about what's being done in Israel to train scientists to speak that language.
Yeah, that's a really interesting question. When I was working in industry, I attended a meeting in DC of the Institute of Medicine, who was holding sessions specifically to talk about the best ways to communicate with the public. So I have not read anything recently on that. I think Nadav, it sounds like Nadav is doing research on that. It's the kind of information that informs us what works and what doesn't work. I teach bioethics also to nurse practitioners who are going for their nursing doctorate degrees. So there is a bioethical component of their coursework as well. And we talk about many of these things. So I think people are doing work on that.
So we have a special course that I'm doing with Professor Moria Ellen, originally from Canada, by the way, also within the modern Orthodox tradition. She's originally from Toronto. And the course is about knowledge transfer and exchange. So it's exactly this very important question, how we need to translate. And translation can be, by the way, between basic science people to clinicians, between clinicians and public health people, vice versa. So translation within the different professional communities, believe me, sometimes it's even more difficult than any other things, because unfortunately, sometimes there is some ego there, and everybody thinks that he or her discipline is the most important one. But I think things improve. We have what is called interprofessionalism. So students are exposed from day one to other professions. but it's also about translating not just to the public, but also to policymakers. So the way of writing, like a short executive summary or doing briefs to the public. And this is something that we understand more and more that is crucial. I'm going from time to time to the parliament. On Sunday, I'm going, unfortunately, to convince some parliament member that it's important that Israel will remain within the WHO. But you need to give your arguments in a way that won't be arrogant, but will really answer the concerns being expressed. So in the question of vaccination, I brought HPV as an example, okay, that there are concerns by some people, not just religious, by the way, that it's related to sexual behavior. And of course, it's much more complicated than that. So yes, there is a discipline called knowledge transfer and exchange and implementation science. We're teaching it online with students from University of Toronto, by the way.
Okay. We have a question that has been phrased differently by many people on this seminar, but I think that is on a lot of our minds. And that's when you look at the ultra-Orthodox Jewish communities, how do they halakhically justify not getting vaccinated, given Maimonides' teachings, given that we know that one who saves a life and doesn't do it is,
Can I start?
Yeah, please.
I saw what happened in the community here. I believe the community was targeted by an anti-vax group, which are very strong in the United States, because I saw a pamphlet. We shop there because we can get our kosher meats in that community. And I see what pamphlets are around the supermarket. And there was a pamphlet written by the members of this anti-vaccine group, which, by the way, are very sophisticated, and we can't underestimate how sophisticated they are. They provide bibliographies with information and take information out of context to support their arguments. They get rabbis of the community, and they do the kind of talking that we need to do, but in the other direction, and convince the community that this is not in their interests. And the community, and then the rabbis are convinced, and they put out testimonials in these brochures to help their people. And there are a lot of the population doesn't have any science education because of their yeshiva system and things like that. And I think the anti-vaccine people saw them as a sitting target. And the epidemic was eventually stopped because the health department went in and prepared their own booklets and met with their own rabbis and were able to be more convincing, because eventually they knew how to talk and they used scientific facts, and the population was able to get immunized and the epidemic stopped. But at least here in my local county, I think that's how things got started.
So same thing in Israel. I mean, during COVID, we went and met with different rabbis. And again, the ultra-Orthodox community is not monolithic. There's so many different, and I'd say that especially the mainstream, they, like the Belzer rabbi, or also Rabbi David Lau, the chief rabbinate, he was vaccinated on the media to show that, it's important to be vaccinated. That's another tool that you can use, like we're using sometime, famous sport people or other or politicians, etc. That's also important. So I think that if you're serious and exploring, the halachic literature, it's clear that you need to be vaccinated. And sometimes you have people that are really not the mainstream rabbis, but in every groups you have the more extreme, and maybe they don't base themselves on even on halachic literature. Another component in Israel that is not true in the United States, sometime in very, very extreme ultra-Orthodox group, but again, there is a tiny minority, it's also the question of being anti-Zionist and anti-Minister of Health. So sometimes the solution can be that you're vaccinating, not entering with, let's say, a mobile clinic with the flag of Israel or the Minister of Health logo, but you're going with people from the community that are vaccinating. But these are really extreme cases. Every time that we were sitting with seriously and presenting the facts and going also with people that are physicians and are themselves very familiar with halachic text, so we solved the problem. But again, you need to do it regularly and create the trust, and not when there's an emergency and people start to fight and people are very anxious or they're afraid that something happened. You need to invest and do these things.
Thank you for answering questions I haven't asked yet, because you very much, I think, spoke about fighting disinformation. And I think you also gave good examples of how to depoliticize what has become overly political and shouldn't be, what should be an apolitical issue. So really, Nadav, thank you for those answers.
Yeah, we heard an interview on TV yesterday that talks about not changing minds but opening minds. And it was a very important quote, I think, in the way we have to start approaching our divisions and meet people where they are.
So two more related questions for you. One is if there are good websites that you'd recommend to help debunk some of the myths, perhaps you can provide those later, and we can send them out in the follow-up to everybody who's been registered today. So a number of people are looking for that. And Bill Liz Levinson asks what the role of rabbis both in the US and Israel should be more broadly in science education of their congregation. So Jill, as a rabbi, can you talk to what you think the role of a pulpit rabbi should be there in terms of basic scientific literacy as well as Jewish literacy on these topics?
Yeah, I think under the rubric of bioethics, we can address a lot of the important scientific scientific information that people need to make decisions in their lives. A session on immunization in an adult education program, in a special pop-up education program. We can have programs about end-of-life issues and the whole host of end-of-life issues, because, that's another whole area, is people in our society don't want to face or discuss death. And there are medical things that can help them understand some of the situations they're going to be facing. So I think in a congregational setting, there are things that can be worked into sermons, but it's not, but you really need, to present ideas. But I think programs within a congregational setting is important. During the measles epidemic, I wrote an editorial to our local Jewish paper, because people were beginning to say, well, they're not being vaccinated. Maybe there's a religious reason that we shouldn't be vaccinated. And even non-observant people, if they can find a religious reason for something they don't want to do, they feel that that's a good thing. So I thought it was important to make it clear that there was no halakhic or religious reason to not be vaccinated. So both, so clearly both in the greater community and also within one's own community, there are lots of education possibilities.
So I would say that during the COVID pandemic, we developed a working group together with about 20 people from the religious community, from the Haredi religious community. And we were working together. By the way, we can also learn a lot from different religious community. Their values of having children going to study almost in any circumstances. And I think that in retrospect, in general, we could be much more proactive to teach outside and to have classes that are ventilated in a much better way. And when you have a value, like the value of learning in Derkas the Torah or something else, you can find the epidemiological, clinical solutions, okay? So sometimes it also reflects your priorities, right? It can be also, by the way, the importance of culture and concerts. And there also we could be much more proactive in not stopping everything. But again, that's something and of course I was sitting on the COVID advisory committee. I'm not a denier of COVID or something like that. But there are lots of solutions, especially about ventilation, that unfortunately even today we're not using, and this is very cost effective and important. When we are dealing with this group of Haredi public health people, I saw in the Q&A, for example, the question of smoking. You know that in Purim, because of an afochu, many religious, including myself, I remember as a child, we are exposed to cigarettes early because it's Purim. So it's like you are being an adult and smoking, and this is of course horrible. So now we had this year many rabbis going out with a letter saying this is against religion in a way, against Maimonides, against all the texts that Jill was mentioning before. So it means that you need to work continuously, and again, not arriving only when there is a crisis, and thinking also, you know, what are the different what is the cultural context that you can bring in, because sometimes, you know, the public health department can create pamphlets that are so detached and even alienating certain communities, because when you have a blonde mother and a blonde a child in a house that look, you know, very far away from what I'm used to, or you don't understand, for example, the density of living when maybe in the family you have 10 children living in 3 rooms. So this is extremely different, and some of the recommendation cannot be applied in such a context. So you need to talk to them, because otherwise I also think that you totally disrespect them, and you're bringing them different kind of regulations that they cannot apply them. But if you're sitting and thinking, there are some solutions that can be done, and then they feel that you care about them. And according to my experience, this is very important.
And that's not only true with immunization, it's so true with all the cultural wars that we're having now in society. People need to listen to each other. There's a lot to learn.
Yes.
Indeed. Nadav and Jill, thank you for this really thoughtful and enlightening conversation. And thank you also for reminding us that neither Judaism nor science have ever been monolithic, right? Science is always about keeping an open mind and having a hypothesis and testing and repeatedly testing that hypothesis, and, you know, and learning as we go along. And Judaism, of course, has always been about debate and dialogue with God, dialogue with each other, and the struggle of figuring out, you know, where truth is and what our role is in the world. And I think your conversation today has really helped bring that to life. I'd like to thank our audience of more than 400 of you who registered for this program today, and let you know that both the American for BGU team and the AJR team, who joined together to put together this annual webinar, so enjoyed that process of collaborating, and they look forward to ways to connect you to the work of both institutions throughout the year. we hope you'll be excited about our 4th annual Conversation on Science and Religion this time next year. But please, please, please don't wait a year to experience more of our programming. Both organizations have a robust schedule of events and learning opportunities. And the easiest way for you to stay up to date with these offerings is through the websites for both AJR and A4BGU. And if you'd like, you can use the QR codes here to get to them. And we will send to all the registrants, we will send follow-up information so that you can, continue to be exposed to all of the great programming from both organizations. And once again, on behalf of my friends at both Americans for Ben-Gurion University and the Academy for Jewish Religion, I really thank you for tuning in today. And I look forward to the continued conversations. And Jill and Nadav, thank you. You are inspiring.
Thank you so much. It was a great pleasure, Jill, to work together on this webinar, and of course, Terry and all the group. So thank you so much, and let's hope for much better news and the hostages that will be back and the war over, and also in terms of public health, that will be in a much better place. There are many challenges right now, so thank you so much.
Amen, amen, amen.
Thank you.